white, and then your phone sits there. You want to kind of be a little bit down here from the white.
Do a little video here on patient position.
Okay, great. Okay.
Make sure
Cool, thank you.
your chair is adjusted properly before you get started. I'm gonna bring the lower back down for me. So, always a good idea. It takes a few minutes to adjust the operator chair at the beginning of the day to a position that's going to be comfortable for you. Okay, there, get glasses on.
So, I had talked to Ms. Chavez before, and she said that you guys were looking at your first.
Yes.
Okay, because I already
So,
said, yeah.
I'm gonna leave the patient back in the chair. Obviously, I'm not following proper infection control because we're using a Typodon and this is a video. So, disregard the infection control violation. I'm gonna leave the patient back in the chair. And again, you want your patient supine. Nose and toes on the same plane. Obviously, chin up, head back for maxilla, chin down, head up for mandibular. So we're gonna start on the upper right quadrant. Alright, so that's pretty good. Okay, for the upper right quadrant. Okay, for the upper right quadrant, I'm gonna position my patient so they're turned slightly away from me. As a right-handed operator, I'm gonna be at anywhere between 8, 9, 10 o'clock position. I like this 9 o'clock position. I like to straddle my legs here and then I can really come in nice and close to the side of the chair. So you can see my light is positioned a little bit back and again is tilted up to completely illuminate that upper right quadrant. So hand positioning. So I got my placement, my patient's placement, my positioning, my patient's positioning, my light. Then I get my graph on both of my instruments. And then I want to establish my fulcrum. So for this upper right posterior quadrant, as a right-handed operator, I'm going to use an extraoral fulcrum generally because it's too hard to get a tooth fulcrum here and get my rocking motion. So I'm going to be externally fulcrumed here on the base and more on the backs of my fingers with the palm of my hand kind of facing up. So then I can still rotate to adapt my tip. So this is a Universal Columbia 1314. So it has two cutting edges adjacent to each other. So I'm going to start at the distal line angle, and I'm going to go around to the distal, come back to the distal line angle, and I can take my strokes all the way around to the PCO. So I'm just going to pretend here I'm working through this quadrant, right? Feeling or moving calculus on these teeth. So I'm pretty much in the same position on the molars with the extraoral fulcrum. Once I can get an intraoral fulcrum, I might come a little bit more back just so I have more hand-on rocking motion and then establish more of a tooth fulcrum just to give me some additional stability. So now as I get to the premolar region, you can see I'm moving more up to about an 11 o'clock position. And so now to clean this anterior segment, I would need to switch to an anterior instrument. I'm going to set my Columbia down, although it is a universal instrument. A better instrument choice would be probably something like a 1-2 Gracie. So I'm gonna grab my Gracie 1-2. I'm going to sit at 11 o'clock, and now I can do all of my surfaces towards me on the anterior teeth using my Gracie 1-2 Curette. So I just select the correct working end for all the surfaces towards me. As I get closer to the anterior central incisors, I come even more back to 12 o'clock. Sometimes you have to push the equipment out of the way. Sometimes you may even need to reposition the chair, the patient chair, and maybe turn it at a slant a little bit so that I can better get now behind the chair and into my 12 or 1 o'clock position. So I'm going to reposition my light. So eliminate the area. So I was doing surfaces towards me. So now I'm back at 12 o'clock, just past the midline. I'm going to continue to do my surfaces towards me. And then I can do my surfaces away. So starting on the tooth that I ended on there, I'm just going to change my ends so that I have the correct working end on my Gracie. And now I can do my surfaces away. So starting to turn the patient away from me again and coming back over to my 10 o'clock position to see those surfaces better. Okay, so now I've scaled all the anterior teeth and the posterior upper right segment. I'm going to move on to the posterior upper left segment. And switch back to my Columbia 1314. I'm just doing an easy prophy here. So for this upper left segment, I'm going to have the patient turning towards me. I'm going to come back to about 10, 11 o'clock. And then I'm starting at the distal line angle again with my Columbia. And I am going to scale to the distal and come back around on the mesial. Have a nice established tooth fulcrum here.
Oh, yeah.
And I just shift my fulcrum more posterior as I move towards the terminal molar. Okay, now I've gone all the way across the facials of the maxillary arch. So to come back on the linguals, I'm going to turn my patient away from me for the upper linguals of the upper left quadrant. I'm going to come back to an 8 or a 9 o'clock position. I like an 8 o'clock position here. My feet are a little bit under the headrest of the chair. I can sit nice and upright. My fulcrum for this area is going to be on the external face, so using an external fulcrum. And my fingers are pointing more down with a palm down, more of a palm down approach. I have to crawl my fingers down the instrument a bit here so that I can really reach my cutting edge to get to the distal aspect of that terminal tooth. Ooh, I got that nice piece of calculus up there. Look at that. Around distal mesial. So I can see all these surfaces nice and directly from where I'm sitting and how I have the patient's head positioned. Once I can get a tooth fulcrum, I'm going to come in and get a tooth fulcrum for added stability. And then I have completely scaled the upper left posterior lingual part. So come back around on the lingual, so the maxillary anteriors. I'm going to come back to my 12 o'clock position. Just a little bit more from that angle so you don't see. There we go. Patient should be nice head back, chin up for this. That way you can try and really visualize those linguals of the maxillary anterior. We're going to do surfaces towards and away in again. For surfaces towards, I'm gonna sit kind of at 10, 11 o'clock. Using my indirect vision, I need to identify the lower cutting edge on my Gracie Curat that I'm using here. So I have the correct bend for surfaces towards, then using my indirect vision, I could have the patient turn slightly towards me, and I could get my light a little bit better in there by shining it more straight down onto my mirror so that I have more indirect illumination, and that looks better. See a little better. You want to have your mirror hand fulcrumed so that you're not just hanging out here, right? You don't want to just be hanging out with no rest. So establish your fulcrum. Get your grasp, establish your fulcrum. And then rock and roll. Rock and roll. I'm going to go through, do all these surfaces towards me. As I cross the midline, I might come a little bit further back towards 12 o'clock and bring my patient's head a little bit more straight up and down. Whatever feels most comfortable for me.
They don't say anything.
It allows me to see the area most efficient. Then I'm going to switch my hands. I'm going to go back, turn my surfaces away. You guys can see I'm not wearing my loops, so my neck posture is not.
I know.
Okay, so now I've scaled all the facials and all the linguals up through the canine. I'm going to switch back to my posterior instrument for the linguals of the maxillary right, the maxillary upper right. I'm going to turn my patient towards me. Then I have to use indirect vision here. If I can establish a tooth fulcrum, I want to establish a tooth fulcrum, but it can be difficult here. A lot of times you're on the external face and reaching for it. You could do a opposite arch fulcrum, so fulcruming on the mandibular teeth to scale the maxillary teeth. But you can see I'm at about a 9 o'clock position here. Have the patient turned towards me. I'm using my indirect vision. These areas are the most challenging areas to scale for us as right-handed operators. So you can see I'm using the extraoral fulcrum here on the external face and pushing against the face to get my lateral impressions. I'm going to come all the way around on the linguals of the posterior upper right section. And then I've completed scaling of the maxillary arch. Once I can get a tooth fulcrum, I want to establish a tooth fulcrum for stability. Okay, so that was the entire maxillary arch from the right-handed positioning. Now I'm going to move down to the lower arch, and I'm going to start on the lower right. Light, so it's not blocking the camera so much. I'm going to turn my patient away from me. So again, sitting at about an 8 or a 9 o'clock position. Patient's turned away. Here I can establish a nice tooth fulcrum to scale the facials of the lower right posterior section. So I can see these surfaces pretty directly. And I'm just using an internal tooth fulcrum close to the working area. Okay, so now I've scaled the buccal surfaces of the lower right. I'm going to come to the lower anteriors again. We're going to do surfaces towards. I'm going to switch to my anterior Gracie 1-2. So for surfaces towards, you can either be at an 8 o'clock position with your legs kind of pointing back, or you could be at a 9 o'clock position. I'm going to bring the patient's head up a little bit more since I'm on the mandible, and actually that's going to give me a little bit better access for probably would have for this lower right quadrant as well, but I didn't do that, so I'm doing it now. Bringing the patient's head up, turn it a little bit towards me so I can access those surfaces towards a little bit better. Identify my lower cutting edge, start mid-tooth, rock and roll. And then as I get towards the midline, I have my patient turn a little bit more towards me. That way I don't have to reach so far over the patient to get to the surface towards me.
I don't feel like I'm so. Yeah.
And then I'm gonna come back to 12 o'clock or 11 to 12 o'clock to do now my surfaces away from me on those lower anterior patients.
Oh, really?
And then as I get over across the midline, I have the patient turn so that we can again access those areas a little bit easier. Okay, now we've got all our facials up to the canine here. I'm gonna grab my posterior instrument again. So we're gonna use the lower left facial of these posterior teeth. So here again, I'm gonna sit about 9, 10 o'clock, maybe at 10 o'clock, have the patient turn more towards me. Should be able to establish a tooth over close to my working area. Right under the skull, coming it back around to the
Some practice.
Oh, I'm making a video.
Oh, sorry.
You're a cameo now.
Oh, no.
Coming all the way around. Yeah, you know me, I just need a little practice on my Typodon. Peyton. Okay, so now we've scaled all of the facial aspects on the lower arch. So to come around on the lingual, I'm going to turn my patient all the way away from me, come to about a 9 o'clock position, 9, 10, angle my light a little bit better to get that quadrant fully illuminated, bring my patient's head up just a little bit for that mandibular. Okay, so now I can retract the tongue with my mirror, like so. And again, we're just starting distal line angle, going around to the distal, coming back to the distal line angle, coming around, and then easy up. So that's your positioning there for that lower left white wall. Tooth fulcrum close to the working area, and then just shifting on my fulcrum to get positioned properly for each tooth. Okay, so now I've gotten the lower left sextant scaled. I'm going to come to the linguals of the lower anteriors. This is just one sequence. There are many ways to clean up both dentition. Okay, so starting here at 12 o'clock, I can do my surfaces away from me. So I'm going to select the proper working end for surfaces away, using my indirect vision.
This is supposed to be,
12 o'clock, coming back around to like, I like to sit at like 8, 9 o'clock for my surfaces towards on the lingual of the lower anterior.
Yeah, I will.
Using my indirect vision. You can have your patient turn either right or left, whichever direction it helps you see and access the area the best. It can depend on how the patient's lower anterior are positioned in their mouth and their dentition. Good. Okay, so that is my lingual to my anteriors. I got one sextant one. The lingual to the lower right quadrant. I'm going to turn my patient all the way towards me. And then I'll probably be sitting a little bit more back here at like about 10 or 11 o'clock. This one's a little challenging with this typodont. It might be helpful if you're working on the typodont on the lower right linguals to take the maxillary arch out, just so you have enough room for your fulcrum finger, because you will want a tooth fulcrum here as well as a right-handed operator. So retracting the tongue with the mirror, tooth fulcrum close to the working area, starting on the distal line angle, and coming around on that to the knee scale. So that's how I would, as a right-handed operator, scale the lower right angle. And here, if I needed to move back a little, I can. I can see these surfaces pretty well directly at my 10, 11 o'clock position to really be able to access that nicely. So that would be the various top positions for a right-handed operator. Left-handed is going to be exactly the opposite. Let's see if I can do a quick demonstration of what that's going to look like. So, for the left-handed operator, for the lower left, you'll be sitting, for the lower left, you'll be sitting at an 8 or 9 o'clock position, and you'll have your patient turned away from you to see the facial aspects of the lower left quadrant. You'll be sitting in this same position to see the lingual aspects of the lower right quadrant and to scale the lingual aspects on the lower right. For the lower anterior surfaces towards, you'll be anywhere between 4 o'clock and 1 o'clock. So this would be for your surfaces towards. For your surfaces away, you're going to be at 12 o'clock. Then for the buckle aspect on the lower left, you're going to be over here at 2 to 3 o'clock. Scale the left. Then you would also be in this position, like 10, right? 1 to 2, anywhere between 1 to 3 o'clock for the lingual on the lower left. Surfaces towards and away for the lingual aspects here are going to be the same as for the facial, so your positioning will be the same as for the facial. For upper left, you'll be using a palm of an extraoral fulcrum and on the backs of your fingers here. You'll have your patient turned away. You may not do that. Patient's head will be back a little bit more for the maxilla. Bring our light back a little bit more and angle it up. So I think it's fully illuminate like area. I would like here. Then you would come up for surfaces towards here. And then you're going to be in this position for this upper right area. Coming back, lingual, you'll turn your patient away. Here you'll be around 3 o'clock position, 4 o'clock position. You see the lingual on the upper right. Your position for the lingual for the maxillary anteriors will be the same as for the facials. And then for the lingual, I would recommend it here. And then I told someone else, she's like, I know, she's like, because you said she was saying that, and I was like, your relationship, like, probably more. It's not true. Yeah, literally. It's a little sweet. Probably more at 4 o'clock position. Don't mind. Wow, that one's confusing me. Let me go back to for that. So you're going to be probably anywhere between 1 and 3 o'clock to see the lingual there on the upper left quadrant. So that would be from the left-handed perspective. So hopefully that's helpful. For efficiency, you'll learn to sequence yourself so you minimize the amount of times you change instruments and clock positions, but hopefully that was helpful so you all could see kind of where the seating arrangement might be, where the fulcrum might be, for those different positions. So, all right, that's it.